Besides getting bageled, having your shoulder hurt while playing pickleball is one of the worst feelings. In this video, we'll talk about some of the common shoulder injuries with pickleball and then some rehab exercises that can be helpful. There are a variety of different reasons why someone can experience shoulder pain with pickleball. One of the more common reasons is a rotator cuff strain. Because pickleball is such a dynamic sport with so many quick movements of the shoulder, it's common for one of the muscles to get irritated. The supraspinatus muscle is the most commonly injured rotator cuff muscle, and it sits on the top side of the shoulder. We can also have injuries to the infraspinatus and teres minor muscles, which are on the back side of the shoulder, because of the repetitive backhand movements, as well as decelerating the arm with overhead smashes. Another common shoulder injury is known as subacromial shoulder pain, and this was previously known as subacromial impingement syndrome, when the mechanism was thought that there was an impingement of the tissues in the shoulder, and that led to the pain. Instead, this actually appears to be a supraspinatus tendon issue, which gives us pain on the front side of the shoulder, typically with overhead movements. As you might have noticed, both of these conditions are overload conditions, meaning that the loads placed on the shoulder have exceeded what it can tolerate, and that leads to the pain. So when we look at treatment of these conditions, load management is going to be an important consideration. This doesn't mean that we can't play pickleball at all until the shoulder is completely healed. However, it does mean when somebody asks if we can play just one more game, sometimes we're gonna just have to say no. For load management, there's several factors that we need to consider: intensity, duration, and frequency. And when we look at pickleball, typically all three of these are elevated. We play every day, for several hours, and every time we're able to smash a ball, we increase that intensity, and so that's just a recipe for an overload condition. So when we look at managing the load, we can modify some of these different factors. If we're looking at frequency, maybe instead of playing every day, we play every other day or every third day. If we're looking at duration, maybe we put a time limit of only playing for 1 or 2 hours per session. And then when we look at frequency, maybe instead of driving every shot, we're actually looking at working on some of the soft game and doing some more dinks, which will just put less load on the shoulder. And the decision of which factor to modify really depends on the person's tolerance to load. For some, it might be the duration of playing that might be the factor that's most relevant. For others, it might be the frequency, or for some, it might be a combination of all three. So when we're looking at managing the load, we have to take a look at all three variables and then seeing which one helps to reduce the irritation on the shoulder. When looking at the shoulder movements during pickleball, there's really two different positions that we want to focus on. One is with the arm by the side to mimic when we drive, when we dink, and also when we're doing hand battles at the net. For the external rotators, the band is anchored across the body. Then slowly rotate the hand from the stomach outwards. For these, you should feel the muscles on the back side of the shoulder. Then for the internal rotators, the position is just reversed, so the band is anchored on the same side, and then we're pulling the band from out towards the stomach. When strengthening both the internal and external rotator cuff muscles, make sure that it is a slow contraction in both directions. This helps to strengthen both the concentric and the eccentric muscle contractions, which are needed for accelerating and decelerating the arm with swinging. The final rotator cuff muscle that we haven't worked is the supraspinatus. Start by standing on the exercise band with the thumb pointing up, then slowly raise the hand to somewhere around shoulder height, depending on tolerance. A key here is that the hand is a little in front of the body when we do these. This is because the shoulder blade is rotated slightly forward on the rib cage, so having the hand slightly forward puts it in better alignment. Then the other position is with the arm overhead to mimic both overhead smashes and whenever we hit those balls that are clearly going out but we want to hit them anyways. Starting in a half kneeling position, we can repeat a similar progression that we just did, starting with slow external rotations, keeping the arm still and just rotating the arm, then switching the position to focus on internal rotation. Then we can progress the exercise so our arm is elevated a little bit higher, which is going to mimic those overhead positions. So here we're mimicking a overhead forehand where the exercise band is anchored high and then we're bringing the arm across our body down to the other hip. We can also do this for backhands where the band is now going to be on the other side and we're going to again start with the hand up higher and then bring our hand across our body once more. When looking at returning back to pickleball after a shoulder injury, we obviously want to make sure that our rehab exercises mimic the movements that we're going to experience during pickleball. But we also have to make sure that they mimic the speed and intensity of the movements that we're going to experience. We can begin by using some of the exercises that we did previously, but focus on increasing the speed. So here we're working on forehands with quick hand battles at the net, and then we can also do our backhands as well, working on either punch volleys or again those quick hand battles at the net. We can also modify some of the exercises to mimic some of the other movements. So here we can work on our forehand drives, starting in a low position and finishing high. Again, starting with a slower movement and then gradually increasing the speed to mimic what we would actually do in a real game. And of course, we can do the same thing with our backhands. Here we're working on a single hand backhand, working from low to high, but we can also use a double hand backhand as well, repeating the same motion. And then finally working on our overhead position. So here we're working on our overhead backhands, but we can also do the forehand variation as well by just having the exercise band anchored to the other side. So hopefully this video on shoulder injuries in pickleball was helpful. If it was, go ahead and give this video a big thumbs up. If you want to support the channel, hit the subscribe button over here. If you have more pickleball injuries that you want covered, leave them in the comments below. I'll see you in the next video.